Welcome to Little Warriors, the podcast. I'm your host, Rebecca Horan, and on episode 5, I'm talking to Dr. Laura Lenihan, aka Dr. Laura GP on Instagram. Laura and I sat down to discuss skin, everything to do with skin and our children, from protecting their skin in the sun to rosacea to acne treatments and laser for scarring. This is a must listen. I never miss an opportunity to get into Lidl to stock up for so many bits for my kids, especially because my youngest is still in their Loopy-Loo nappies and they've got the Loopy-Loo biodegradable water wipes and the pants right up to size 7 as well. And do make sure to keep an eye on the Lidl Plus app for regular offers on the Loopy-Loo range. And thanks again to Loopy-Loo by Lidl for supporting the podcast. We're all obsessed with skin. Okay, we are. And I think in this country, but also we've just been fed so much as, particularly as young girls and teens. And I just know I was obsessed with my skin and had problem skin. So I have on the podcast a real treat, Dr. Laura, but Laura Lenihan. Her handle on Instagram is Dr. Laura GP. And she is, you know, a GP, a doctor, a general practitioner, but you specialise and your big, exciting area is skin. You love it, love it, love it. Welcome to the pod.
Thank you so much for having me. Yeah, so GP by trade, but I do skin all day, every day, and absolutely adore it. Yeah,
how did that come about? You were saying to me, like, you know, you trained, you were in medicine, but then this was the thing you really wanted to foray in. Tell me how that happened.
Yeah, so I did postgraduate medicine, and I think when you're going into it, you have a bit more of an idea where you're going. So I was 26 and I came out at 30, and skin was always my big interest, but I knew that I didn't want to do dermatology because it's a significantly long career path and you have to move around. And I was 30 coming out and I knew I wanted kids and I wanted to live at home in Galway. So I did GP and I did all my extra kind of training was in dermatology. So I spent a lot of time with the dermatologists in Galway. And then I just learned as much as I could because there isn't a huge amount of training in the cosmetic or aesthetic side of things. So I learned all I could about skincare. And and since then I opened my own clinic. So 5 years ago now. And it's going like really, really well. Love it. Yeah.
Why skin? Why was it your thing? I know medicine was obviously you wanted to get in and help people, but why was skin this? Was this a teen thing?
No, I never had bad skin. I don't have
well, you
a
can
really
see
interesting.
That.
I don't have a really interesting
story.
Backstory.
No
yeah,
trauma.
I don't. No trauma. I had the usual, like, you know, pimply forehead when I was in my 20s. But I've always just liked it. I was never like a makeup person either, you know. I fell down a stairs in my granny's house. My mother was away in Cyprus and my dad had to deal with it. So we asked a friend to bring me in. I got makeup. I remember getting one of those Estee Lauder things. And I was a teenager and I put it on to try and cover the black eye and I got spots. And I think that put me off makeup from an early age. And I never got spots after that then. But yeah, I just always had a graw for it, I guess. And it's so rewarding.
We care about our skin because, let's be honest, like we can kind of make it a like aesthetic thing. And like, you know, we're talking about makeup there and the noise and big brands, you know, making millions, billions out of us. But skin is the first thing that is out there, you know, your hair and your skin as a young adult and as a woman. And it's a pretty big deal, right? And I know when I was young and girls who were going through the worst kinds of acne, I'm not talking about like, oh, I'm feeling a bit like the worst acne to the point where they really didn't want to go to school. They couldn't go out and meet people. They definitely weren't interested in dating boys because they were so self-conscious. They felt really unhappy and depressed sometimes, right? And this can go into our adult years. So skin, you know, we can talk about it like mind and it's beautiful, but it can be actually all about our self-esteem, the foot that we put forward, all of that. So would you agree on that it's a mental health thing too?
Oh, 100%. And actually what the studies show us is it doesn't matter how severe it is. So I know you mentioned earlier before we recorded that you had really bad acne as a teenager. But actually to the girl who just maybe has the one spot or the few in the cheeks, it can be just as bad. She can be just as affected from a mental health point of view. And we know that. And it's really easy to kind of, I suppose, be like, oh yeah, but that's mild, you know. And so if I ever see a patient and I say, look, it's mild, I will always say, I'm, you know, objectively grading it. You have mild acne, but that is not to take away from how you feel about it or how it affects you. And I think that's a really important part of it. But yeah, I think we deserve, and it's not vanity, right?
No, it's not.
I think that's a really, you know, I had a big surgery this year, but it's your mental health. It's how you feel in yourself. It's that confidence that you have, that feeling of, okay, I've got this. I'm good to go. I can face those other girls in school, or,
Yes.
that, and feeling that confidence. It's huge.
It is huge. And, you said something to me, like I'm talking as a 42-year-old woman and I get the odd pimple and I go to work and I put makeup on, I go home and take it off. But you were telling me there, and like, I know it's not common place, but you were saying there are a few children
Yeah.
that are presenting with acne. Talk to me about that.
Yeah, so I see a lot of acne in teenagers. So again, their mums are probably patients of mine or follow me on
Okay.
Instagram, and so they bring
They
their
come.
kids. And again, I wouldn't say I treat acne aggressively. That's definitely not the right term because, as I said, I don't prescribe Roaccutane.
Yes.
But I treat acne. I treat it as a medical issue. What is
Good.
it? Which is what it is. Acne is just the medical term for spots. So I have
Good.
patients that'll sit in front of me. They're like, I don't think I have acne, and I'm like, you have acne because that's just
Spots.
literally means spots. But I treat it, and I treat it medically. So for the most part, I'll give them a medicated cream alongside a skincare routine. From 9 years onwards, now I've 2 or 3
can't.
patients that are 9.
Is
Yeah, it's
that a
extremely young.
pre-puberty? Like, what
Like
is
a pre-pubertal, yeah. Now, sometimes it could be related to them using skincare or overdoing it with
reaction.
SPF or something like that. But no, often you'll start to see the signs then. Puberty, menarche is becoming earlier and earlier, getting earlier and earlier. I didn't get my period until I was 15. And I've crossed my fingers every day that my 3 daughters will get to that stage.
Yes.
But yeah,
Pre-menarche, does it mean your child is going to get periods a little bit younger?
potentially, yeah,
Or does it
absolutely,
just
yeah.
mean that they're heading towards that?
Yeah, it depends really, I suppose. So, it can come on, it comes on in stages. That's the way adrenarche, menarche works. But it's definitely, there does seem to be a trend of it occurring earlier and earlier.
Okay, do we know, and I know this is getting a bit into kind of off-piste here, but do we know why that is happening?
No, I don't. Definitely
Okay.
not my area
Some
of
evolutionary
expertise.
thing. It's bizarre, isn't it?
Yeah, evolution takes a long time to
I was
catch
gonna say,
up,
this
though,
is
you see. So
bizarre.
yeah, so I don't know
Or
that.
was this always happening, but we just talk about everything more? Like, were there children when I was growing up at 10 or 11 getting their periods, and perhaps we were all 14 and we just didn't know about it?
Yeah, maybe there were a few,
Yeah,
and maybe you
okay.
see them more now. Yeah, I won't lie, that's
Okay.
definitely not my area of
Okay.
expertise, so I don't know. But I feel like I'm seeing younger and younger
Yeah.
kids coming in.
I feel like I'm hearing about it.
Yeah,
So if you have a child coming with their mama or dad at 9 with acne,
yeah.
is the child aware, and is the child the one who would have said it to the mom, or is the mom the one going, let's get you sorted because I want to help you?
Most of the time it's the mum.
Yes, correct,
Yeah.
right? Because I just feel like I have, an 8-year-old, near 8-year-old, she's 7, and I have a little 4-year-old, and I know it would be me who would see the thing, right?
Yeah.
Because we never want to make our child super
Aware.
aware, but we are aware.
Yeah.
And they're often not
Yeah.
at all, completely
Yeah.
don't care. So there's a fine line, and like again, this is kind of a different conversation, but there's a fine line between putting that upset on your kid.
Yeah.
So how is that?
I think that's a really difficult thing to deal with, right? Because the mum has the kid's best intentions at heart,
Course.
obviously, and they're thinking, and often when in my case, say the mum will have had really bad acne before,
been
and so
through it.
it's
Yeah.
triggering them, and they're like, oh my god, I don't want them to go through this. And so in their mind, they're doing the best thing by bringing them in and getting them early, which I definitely
I was going to say,
agree
you can
with.
kind of nip it in the bud a little bit.
Absolutely, yeah,
Oh,
100%.
great.
And like sometimes I won't go in with medication. We'll give them like a really easy cream that they can use, or even just a cleanser if it's not that bad. I see them back in 3 months
Does it
and then
work?
review. Sometimes it does if
Okay.
it's mild. Yeah, I mean, honestly, when they're younger, I'll try it because I really don't want to be putting like a 9-year-old on medication that they're probably going to have to stay on for.
And when you
a
say
considerable
medication, like,
period.
are you saying an antibiotic to clean?
No, a
in turn-
prescription medicated cream. Yeah, so
So
a
something-
retinoid, like different adapalene
Okay.
or something
Which
like
is
that.
hardcore.
Yeah, yeah. Or something like a little bit of salicylic acid or La Roche-Posay
Okay.
Effaclar or
Brilliant, yeah.
something like that. But if I can get away without doing that, I always will. Like I had one last week, and I was like, look, we're just going to try the Effaclar Effaclar, whatever it is from La Roche-Posay. I should know the name of it. Let's give you
Let's
3
clean
months
you
on
out a
that
little
and
bit.
see, because it was a very acute kind of. It had only come on in a month, but the mum had significant acne scarring from when she was younger, and so I'm like, but I need to see it back in the 3 months to make sure it's okay, so that we get in there then with something more if needs be. But I don't know how you broach that. I suppose the way I do, I have 3 girls. They're 5, 7, and 9, and I try to get them to wear as much SPF as possible. Yeah, and their skin definitely does get a little bit congested with the SPF, and so I talk about cleansing, and I talk about it from a place
Wow.
of skin health point of view. So we wear our SPF to protect us from the sun. My kids understand that completely, and then that we need to cleanse that away. So I try to talk about. I try to not bring up. They don't
It's
have
not
issues.
a routine or a vanity or a, like,
Yeah.
this is a thing we do
Yeah,
for
this
our
is
health,
just
like
the
our
same way
supplements and
we,
our.
we wash
Get
my
it.
husband is
Get it.
obsessed with them washing their armpits, even though they
I
don't
know,
smell.
it's so
They're
funny,
kids,
isn't it? Mine is
but
too.
I guess it's
Wash
just
your private
learning.
parts, wash your. I'm like, okay, they are, and they're also tiny,
Yeah.
and let's not over egg it. Yeah, it's
Yeah,
funny.
but it's just, I think, and there's different takes on this, but I think it's not about vanity, right? And that's a really important
It
part
is important.
of
You were
it.
saying that to me before. This is protecting your skin from
Absolutely,
cancer,
especially with SPF. And so training them into a healthy way to look after your skin isn't a bad thing
which I don't think we
either.
had, Laura.
No,
Right?
no, God, no. Absolutely terrible. So I agree. So I'm the same age as you. I didn't know. I don't remember knowing. I remember just thinking, I feel so much healthier and better looking, in inverted
Yes, more
commas, or,
attractive.
with a tan. So I thought a tan was healthy because that was what was talked about, a healthy tan. But actually, tan is
It's not
damage.
healthy.
It's not healthy in
There
any
is
way,
no
shape, or
healthy
form.
tan unless it's from a bottle.
That's it, right? Okay, and I talked about this lady on Instagram, and I got a little bit of pushback from some people because their kids. I have a kid, one of my middle child, Indy. She tans like that. Okay, so
But she's wearing SPF.
she's wearing factor 50,
and she's still tanning.
Yeah, so
same
that's
as my girls.
protective mechanism in
That's
a way,
okay,
right?
yeah.
But it's also, there's still damage going on. But say for Indy, way less damage causes her to tan, and then it's being protective versus our typical Irish Fitzpatrick 1 and 2 skins. We take a lot longer to tan, so way more damage is occurring, and then we're getting way less protection. So it's really important to understand that every time UV light, so the sun rays, hit your skin, they damage your DNA. Okay, and I'm not trying to fearmonger or anything like that, but it's really important to just understand
we're
this.
devils for saying on holiday, and I hear other mums and dads saying it. You've sallow skin, you're okay.
No,
honestly, Laura,
Yeah.
I hear this,
And I'm sallow,
I'm
but
not
it's not
doing it.
okay.
I throw on that they've actually had block 100, then down to 50. Both have very different kind of skin shades or types.
Yeah.
And I would still be milling them just because, like, God forbid they burnt. I swear I'd be feeling so terrible. But I have heard mums on holiday going, "You're all right, you're so."
Yeah, not the case.
I'm like freaking out. I'm like, if these kids burn, and you see so many burnt kids,
and loads of and every time you get a serious burn, it like doubles your risk of melanoma, skin cancer. But that DNA damage, so what causes cancerous cells is DNA damage. So your DNA gets damaged over and 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 over, and eventually it can't repair in itself, and it becomes an abnormal skin cell and can turn into cancer. And it's that DNA damage then that causes the release of melanin, which is what gives us a tan, but it also gives us endorphins, which makes no sense because that's the good hormone. It makes you feel good. That's why we like a tan, but it's damage that's doing that, no matter how much.
Do we have a lot of skin cancer problems in Ireland?
Yes,
we do, don't
massive.
we?
Yeah, because
we don't wear it, and you're okay.
Is it 11,000 cases a year? I've forgotten the stats
because with the breast cancer, which is so vital, talked about in prostate and men, but I'm like, I think skin cancer is pretty huge.
Oh, skin cancer is the biggest. So non-melanoma skin cancers, SCCs and BCCs are the highest.
Okay, so
level.
from birth, do babas have to wear sun cream? Well, they're not in the sun, really. They've hats and...
Yeah, so technically up to 6 months, they shouldn't be exposed. I think that's pretty hard. And, we like to holiday a lot. We would have been away. So I would have them in a UPF swimsuit, the hat
Listen
on.
to this, lads.
But then I would have sunscreen on their face and hands and legs
what
if
would
they
you
were
put
being
on, like
exposed.
50,
factor 50 plus, and then 6 months onwards they're in the sun. But like my kids, I mean, sometimes we put bikinis on them now, but as much as I can put a UPF clothing on, I will, and then a factor 50 plus.
Okay, so swimsuits, bikinis, keep the hat protecting the face, loads of sun cream. We're reapplying. They get out of the pool, and I feel like it's gone again. I know you're going to say, I know you're going to say, oh, like it lasts and it's waterproof. I'm reapplying.
Yeah,
we spend so much money on
sunscreen. So you should be reapplying every 2 hours, but most won't offer you enough protection after a swim. So if my kids, like when we go away, we'll tend to kind of sit for the morning and we'll maybe spend 2 hours. If they come out of the pool before that time, we're reapplying. Otherwise, we're kind of do our 2 hours, and then we'll go for our lunch, and then we'll come back out and we'll reapply again. But reapplication is really, really important. You do not want them to burn.
Okay, guys, are we listening to this? You might have a child who's a little bit more sallow than you and your husband, or seems to freakishly tan and does its athletics, but like throughout the year, if they're exposed body parts, they should be
wearing SPF.
Because if you're seeing a child that's tanned and you're like, God, gorgeous, that is damage. When you're in your teens and your acne is so bad and your confidence has hit the floor, what are you treating? Are you doing laser? Like, what are you doing? Are you upping the medication? Like, where are you going with that? And does it work?
Medications for acne? Absolutely. So I guess it very much depends on the patient, their type of acne, their skincare. So when you see me, for example, what I do is I'll give you medication. So I might give you antibiotics to dampen down the inflammatory
Okay.
response to begin with, but I will always do that alongside medicated creams. And you should never, and I see so many people and their GPs who just, we don't know, we're not trained enough in skin, who just give them an antibiotic. You should never do that. You should never just have
On
an
its own,
antibiotic by
okay.
itself for skin, for acne. You should always have some sort of a topical cream alongside it. So I take it one step further. So I give them the topical prescription creams, and then I give them exactly what to use from a skincare perspective. So I tell them what cleanser, if they're using a serum, depending on their age, their skin type, their ability to do a skincare routine, what moisturizer and what SPF. If they've back or body acne, I'm telling them exactly what body products to use
In
as
the
well.
shower or in the
So
bath.
in the shower and afterwards, so body specific body lotions, sprays, and kind of medicated cleansers that they can use for body acne.
But we shouldn't be scared to present early. Like if I was starting
That's
to see
the
one of my
key.
kids, okay, I love this. I love that you're not saying, God, you know, the vanity in mums and dads now. Like you're saying, actually come in, talk about it. Like we don't have to go hardcore route, but
Yeah.
let's help these kids so they're not feeling like shit. We have enough to deal with in our teens, right?
Yeah.
With our academics, our socialization, you know, our body image. We don't need to layer on top of it skin, right?
Yeah. And don't talk about it in a because most teenagers don't feel it. Some do. Some are very affected by it, but a lot don't really care at all or even notice, which is great. But that being said, there's nothing wrong about getting in there sooner rather than later, because they might. And although I explained all of those things that we might do, I might just go in with, you know, while I'm saying kind of the what we might do, that's the ideal scenario. We might just start with a really simple over the counter routine, or simply one medicated, you know, prescription cream at nighttime. There are so many different options. And with acne, like, it can cause scarring, it can cause, you know, not proper scarring, but red marks left afterwards that young kids find very difficult to deal with and will wear makeup a lot to cover. And so the sooner we can get in and treat it, the less likely they are to occur as well.
And turn you around a
Oh, sorry,
tiny
yeah.
bit. No, you're grand. This is a stupid question, but maybe you might have the answer. Is it more likely that a boy or girl will suffer with acne, or is there no, it's just completely neutral?
I should definitely know that
No,
stat,
I'm just
but I
wondering.
don't.
It's
Yeah.
interesting to me.
I mean, in teenagers, it's probably 50-50.
Okay.
Yeah.
Okay.
Yeah.
Birthmarks, scars, children who have maybe had an accident and there's something. Are these kind of things just a long-term approach you're taking, where it's like creams or medications or, I don't know, retinols, or like, how do you approach, or is it more of a cosmetic situation if someone has?
I mean, it very much depends on exactly what it is. Okay. So, for example, if they have a birthmark or kind of a vascular malformation, you know, strawberry hemangioma, the red marks that you see, or abnormalities like that, you know, there are, I suppose, public healthcare hospitals that will offer kind of laser treatments if they are wanted, mainly by parents, I suppose, from a cosmetic point of view. We don't treat a lot of younger kids with laser because insurance just doesn't tend to cover it anymore, even in spite of it's often parents that will bring people in. And I do see younger people. Scars and things, again, it will depend on the scar, what caused it, you know, what you've done, how old it is. I had a patient in recently with scarring, self-harm scarring, and you know, we've used silicone tape, silicone gels, retinoids. Just started to see her, so at a very early stage in it. That's a very kind of,
That's too broad a question.
too difficult,
Because I do remember growing
up.
up and there was one or two children who had those massive birthmarks, which in my eyes, because anyone that was different was beautiful. I was like, oh my God, so exotic. But I remember one of the girls growing up and really as a teen being super self-conscious.
Yeah.
But I'm not sure at that time, 90s, noughties, there was much being offered or much being done. So I was just wondering if there was a change.
Oh yeah, so there's things like pulse dye laser and different lasers, and they definitely are offered, but they'll only do a certain amount. They're not extremely comfortable. So often the kids will need sedation. There's lots of side effects, so they can get bruised.
It's sore.
Yeah, absolutely. So I have another patient who we treat for her birthmark now. She was treated as a child, but she can only do so much. So we kind of keep it under control now a little bit as
God,
well.
you've so much. It's actually, I can see why you were like, skin is my thing. It's fascinating.
Oh, so interesting. I love
Is
it,
there
yeah.
a biggest, like I spoke there about obviously Irish people and their SPFs, and I do think I'm so glad you've hit home on that because it's just so dangerous. But is there a thing that we most likely, more than any other nation, struggle or suffer with? Is it the eczemas, rashes, redness and skin psoriasis, or not really at all? Is that all bullshit?
So they talk about rosacea being the curse of the Celts.
What's rosacea?
So rosacea is kind of inflammation.
Is
in
it the
skin,
ruddy?
So redness, the ruddy complexion? Yeah.
Where? Mainly on cheeks?
Mainly on cheeks. Okay. Yeah, the nose can be affected sometimes. And then I definitely see kind of a mix of acne, rosacea, seborrheic dermatitis, which is like dandruff on the face. That's and I'm in the west of Ireland. I'm in Galway. We see a huge amount of that.
What do you mean dermatitis? Like flaky skin?
Like flaky skin around the nose, maybe in between the brows, in the brows.
Why? What causes that?
An overgrowth of yeast. So same as dandruff on the scalp. Yeah, so that's super common as well. But rosacea is probably the most common, not common in kids really, but in women over the age of 30 plus.
Is it a genetic? What is rosacea?
Yeah, genetic predisposition. So it's interesting. We don't fully understand it, but there's a genetic predisposition. So most people will say, oh yeah, well my mum has, the rosy cheeks. And then my question is always, where does rosacea start and ruddiness end?
Yes.
Should all ruddiness, all redness be considered rosacea potentially? And definitely our skin, our Celtic, Fitzpatrick 1 and 2, light skin types are more susceptible to that. And more
I've never heard that ever in my life. Fitzpatrick 1 and 2. What are the...
So there's 6 Fitzpatrick skin types. So
this is fascinating. Why is it called Fitzpatrick?
That was the guy who... developed it,
Gotcha.
I suppose. Yeah. So it's to scale the kind of amount of melanin. So Fitzpatrick 1 and 2 would be like 1 is really pale, blue eyes, blonde hair, doesn't tan at all, always burns, and all the way up to Fitzpatrick 6 would be black skin type.
So it's a very short little barometer. Like it's 6.
Yeah. So we would fall. So typically Europeans would be Fitzpatrick's 1 and 2s, kind of Spanish Mediterranean might be around the 3, Asians around the 4.
And then you're getting into
your darker
skin.
browns. And
so if you have a child that you were saying tans easily, even though she's protected, would she be a 3 or still a 1-2?
Yeah, so I'll say my middle child is definitely Fitzpatrick 3. Her
That's
skin
interesting.
type is totally different
daughter,
to ours, yeah.
So, okay, what were we saying there? The ruddiness, where does that line?
Yeah.
There is rosacea, like I remember seeing it, and sometimes you'd have burst vessels.
Blood vessels, yeah.
Yes, and then there's that really, so that is very different to someone having a flush. Or someone who goes red, perhaps it's more of a like, not psychological, but they are in certain situations, and we talk about no, you're not at all, not at all. But there are people I've interviewed, and they're full glam or whatever, but you can see through that they get this red coming up, and I actually think it's very endearing. But they're like, I bet I'm blushed or I'm. Yeah. That is purely from how we're feeling. What is that? So that's not rosacea.
That's not necessarily rosacea. Yeah. So that is kind of sympathetic nervous system kicking in.
Yes.
It can be anxiety manifesting.
Like we would sweat. It's different. Yeah.
So there can be different things for that. Rosacea. So certainly like in situations, you can get flushing with rosacea. So rosacea has kind of 4 different types. So erythrotelangiectatic is redness and spider veins. Okay, so that's that flushing potentially or redness to the cheeks and the spider veins. Papulopustular is what they used to call acne rosacea, but it's a good description. So it's the spots associated with it. Type 3 is ocular, the eyes, and type 4 is rhinophyma. So the kind of old man whiskey nose is again the easiest way. Yeah.
I always hear that. I'm like, what is that?
Yeah, so that's a type of rosacea, a specific type that affects males more so than females, although I do have 2 female patients with it. But
you can treat all of this?
Yeah, depends.
Hard.
Rosacea can be particularly difficult for some patients.
And then you're finding makeup's being milled on or not?
Yeah, I think, they're using tons. I was saying about why I got into skin. It's one of the most rewarding things you can do. And I had a patient who had extremely bad rosacea. And I remember when I saw her at the 3-month mark, so she never went anywhere. She didn't even open the door without putting makeup on. And she told me that morning she opened the door to the postman without makeup on her face after 3 months of a skincare routine with us.
Oh my God.
And she just the look, she was so happy. So
that's very emotive, because I'm thinking of even just being a teen and having a boyfriend and like playing hockey and being very active, but feeling very self-conscious. And like makeup back then, it wasn't developed. It was probably cheap. Let's be honest. I wouldn't have had money to buy something fabulously clinical or recommended. So it was probably something very cheap, and I was, and it doesn't help and it doesn't look better. Let's be honest.
No.
And I do remember that feeling of, and I don't think the boy noticed, I don't think your friends, I don't think anyone cares, but I just remember the deep upset. and really not wanting to be out and about and just hiding, Polonex or thing. And like, it can affect kids, adults, it's just
Everyone,
horrendous.
all ages, not even just, like
I know men who
patients,
shave and they've stuff under their
60s, 70s, that are affected by it. It affects you at all stages because it's your face. It's what everyone sees. And no matter how you might feel about it, you're worried that they're looking at you and thinking, God, you're diseased, or there's something wrong, or why is she so red, or why does she have so many spots, or what's that red? Whatever it is, you can become so self-conscious about it. Most of us don't notice anything about anyone else.
They're
but,
so interested in themselves.
But this is how patients feel with it.
And the rashes, the eczema, the psoriasis, like I know this is we don't have enough time today to get into that deeply, but I know that the Silcox base, I remember things being recommended when I was a kid. Is that a whole different ball game? And because I do know parents who really struggle with their very young kids with those.
Yeah, so there's a lot more research coming out if we take eczema, right? Because that's the big thing for kids. There's a lot more research coming out now, and we know that if we go in with soap-based substitutes, am I allowed to talk about brands in particular?
Yes, absolutely. Oh my God!
Like, say the Bioderma Adodome shower oil, so it's an oil-based product,
which we're always being told oil treats oil.
So like I would go in with an oil-based product in the bath, and then straight in with a moisturizer for kids. The Lipicar Balm AP Plus M from La Roche-Posay is my favorite. So if
La Roche-Posay is just great.
It's so good, yeah. So if you're in any way prone to eczema, if there's a family history of eczema, we know now that going in early with these emollients, not the Silcox base, okay? All that does is it just sits. That's it. So it's not actually doing anything for the skin underneath it. So there's loads more research coming out. So anytime I see someone with eczema, they're definitely using Silcox base and they're using it to wash, and I'm like, oh my God. And that's fine, okay? But it's not good enough. And so when you make those little tweaks, that's when you can really see a difference. You're repairing the barrier, strengthening the barrier, because the barrier is like that instead of like that. So Silcox base or the likes, or emulsifying ointment or paraffin, the barrier is still like that, but you've made your own barrier on the outside. So you're not actually dealing with the issue in eczema.
Not penetrating it.
Yeah.
I have to let you go. I don't want to let you go. Maybe we'll get you back again sometime. Laura GP has like huge following on Instagram, but also then a clinic following, right? So there's another page for that.
Yeah.
Massive following, hugely valuable tips for children and adults and women and men alike, like brilliant page. But I want to quickly, before I let you go, get you on a kind of controversial topic. And I really hope that you just give a very honest answer. Everyone's like, Botox is so bad. It's so bad. Why would you bother to be natural? Botox is okay if you want it, right?
Absolutely. I love Botox.
Okay, so bad for you, unhealthy, like what is all of this noise?
Yeah, so no, it's not bad for you at all. So it is like botulinum toxin is a toxin. Obviously, if you get botulinum toxin sickness, it's not a good thing. But what they've done is they've taken the toxin and purified it. And there's so much talk about it. I saw loads of posts this last week. And it enrages me because it's people who don't really understand kind of maybe what they're talking about or how it works. So what it does, it stops. So the nerves still send the kind of signal to the muscle to move, but the receptors on the muscle are blocked. And so then the muscle doesn't move as much as it used to. So I have Botox, but I have tons of
face.
I have a face and my face
gorgeous,
moves and I can show emotions, etc. But there's an awful lot of judgment around Botox as well, and I think it's not for everyone. That's absolutely fine. If it's not for you, that's okay. But if it is for you, and if you want to soften your fine lines or wrinkles, or if you're afraid that you have resting, BITCH face, and you've got this line here, and you want to put a little bit of toxin in it to soften that, then absolutely. It's actually one of the most studied treatments that we have. It's been around for about 20 to 30 years now. There is over time, I suppose technically the muscle maybe might not be as strong kind of later in life. That's going to happen anyways. But what Botox does, it just puts pause on the aging process. So you stop the muscles moving. If you do it for a year, you're a year less old in a muscle's point of view. When you stop it, the muscle regains its strength, the lines come back, and off you go again.
This is life, you know, and no one is encouraging anyone to do it too young, nothing to do with teens here, nothing to do with that. But as a grown-ass woman, you can choose these things. Dr. Laura,
Absolutely.
You are a mine of information. I could have had you for an hour or two. You're so brilliant. Thank you so much for coming on the pod.
A pleasure. Thank you.